Hi, I'm Dr. Ahmadi. Today I'd like to talk about the topic of custom molded orthotics. Many people think custom molded orthotics are just inserts that you put into a shoe, very comparable to a Dr. Scholl's. I want to go into a little further detail as to why people need custom molded orthotics, how custom molded orthotics work, and the benefits of custom molded orthotics. So, to begin with, pronation is one of the number one major causes of pathology, okay? So if you can look at this and appreciate this, this is a neutral position. As you pronate, the foot flattens. The distribution of weight is taken from the normal congruent joint levels and is transposed in an unequal manner through the joints in the foot, ankle, knee, hip, and lower back, causing many pathologies in those areas. So what the orthotic does is the orthotic maintains the subtalar neutral position. So as the foot strikes and is going into the mid stance, it captures that subtalar neutral position, does not allow the foot to pronate, leaving all joints congruent, and the energy and the force goes equally through all the joints. Reasons why people need custom molded orthotics. For instance, if you have plantar fasciitis, which is pain in the heel, secondary from pronation or flattening of the foot or the arch while walking, custom molded orthotics would be very beneficial to maintain the subtalar neutral position and allow the foot to walk in a very effective fashion. Neuromas is the second area where it's an enlargement of a nerve in an inner space, usually the third inner space, secondary from the way a person walks, or shoe wear. What the orthotic does is it maintains a neutral position and also adding some accommodations to alleviate the neuroma. If you have Achilles tendonitis, again, caused by pronation and the way a patient walks and activity, the orthotic creates an accommodation as a heel lift in the back and again controls the pronation to alleviate the tendonitis. These are a few kind of common things that the orthotics are used for. Orthotics can be used for wounds to offload and unload certain areas and take pressures off the stress areas of the foot. Let's talk about the way orthotics are made. There are three ways that orthotics are made. One, stepping in foam. Two, a computerized device that has a pad on the ground, which where you walk on and it gets an impression of your foot. And three, the old-fashioned way, and my favorite choice, is the plaster of Paris. The reason I picked plaster of Paris is because it captures the position of the foot in a non-weight bearing position, meaning that I can control the way I want the foot to be and capture the subtalar neutral position. The subtalar neutral position cannot be captured, or it's very difficult to be captured when the person's weight bearing, which means stepping in foam or walking on a mat. So I think plaster of Paris, although it's a little more time-taking, is the most definitive and effective way of creating a custom molded orthotic. Orthotics don't correct anything. If you want something corrected, you can only do that by surgery. Orthotics accommodate, meaning it's like a set of glasses. If you put the glasses on, you can see. If you take them off, your vision is blurry. So orthotics should be worn at all times, because if they're not worn, the foot's maintaining and doing what it used to do, which means pronating.